You are still watching Ways. Now, National Doctors Day is a day celebrated to recognize the contributions of physicians to individual lives and communities. The day varies from nation to nation depending on the event of commemoration used to mark the day. In some nations, the day is marked as a holiday, although supposed to be celebrated by patients in and benefactors of the healthcare industry. It is usually celebrated by healthcare organizations. Staff may organize a lunch for doctors to present the physicians with token of recognition. Historically, a card or red carnation may be sent to the physicians and their spouses, along with a flower being placed on the graves of the deceased physicians. So this is National Doctor Day. Do you have any doctor in the family?
Oh, yes.
Oh.
I have 2 doctors in the family.
Awesome.
My junior brothers are both doctors in America.
They're in the America.
I want to say in the United States. And
Also,
yes,
doctors are amazing.
Amazing. They're very
lifesavers.
doctors.
They are weight in gold. I just think that families that have doctors really don't know the value. I have a friend right now. Her dad is a doctor, her sister is also a doctor, and her mom is ill. And the health sector, we've talked about it so many times, we know that it's in a complete state of disarray.
Yeah.
So to have someone in the family
that
who,
can just,
it's like the extra personal touch. And someone that has the knowledge to really explain what the doctors mean. Because sometimes doctors just speak and they tell you this is what you need. But at that point, you don't know if it's real, and you don't even know the quality of the doctor. So just having a doctor in the family that's telling you, okay, check this is what this means, it really makes the world of difference when you're
especially in Nigeria, because you go to the hospital. So for people like me, I can be very annoying if I go or when I go to the hospital. I don't fall sick, my children don't fall sick, but I have an adopted daughter who I had to take to the hospital, I think it was last month. Everything that I diagnosed at home was what I told the doctor when we got there. He checked it. He now was like, are you a doctor? Have you been in the medical? I said, no, I have 2 doctors at home. So everything we say in my house is just medical. They talk in medicine. They don't speak English. So it's very interesting.
It's interesting. Yeah. I'm excited. I was in a meeting yesterday. Yeah.
Future doctor.
Yeah. I was in a meeting yesterday, and a lot of people are actually looking towards Africa to change the face of, people are actually, because I have a friend of mine that is we were in school together. He's a doctor in Germany, and he was telling me the last time we spoke about possibility of coming back to Nigeria. A lot of medical doctors want to actually come back to establish proper healthcare structures. Do that and guess what? It's going to happen very soon. So I'm excited about that.
On the table, Nigeria will frustrate them out of
We will frustrate Nigeria.
No, you know why Nigeria won't frustrate them? Because they lived here, number one, so they know how Nigeria works. They know how the system
and again,
is.
COVID has taught these leaders that when it comes to those healthcare structure, they should please allow them to
Let me tell
work.
you something. I was one of them. They're very well meaning. When you live abroad, you think, I'm going to come to Nigeria, I'm going to fix all the problems. I had a very close family friend. He's a civil engineer. Same thing. I don't understand why Lekki floods. There's water on one side, there's water on the other side. It's easily fixed. He went back with his tail between his legs. Y'all are not ready.
No, but don't worry. Some are ready.
Some are ready. And we will help make it possible for them, facilitate it, because we need doctors in Nigeria. Trust me. All right, so let's go to what we found. Manny, let's start with you.
Okay. So I went to the medical field. So it says COVID-19, Nigeria misses WHO vaccination target. Experts task NPHCDA. So it's been 2 years since the introduction of deadly coronavirus pandemic and its global impact. Since then, vaccines have been made and healthcare responses to the virus has been bolstered. It's been reported that Nigeria is lacking behind on the COVID-19 vaccination target set by the WHO, that is fully vaccinating only 20.5% of its population so far. For me, that's even all right. And partially vaccinating 10.7% of the total eligible population. The WHO set the target of 70% mid-year COVID-19 vaccination target. So Dr. Moiti used the platform to encourage and appeal to everyone to get the COVID vaccine. So a public health physician and Senior Vice President for Africa, Human Health Education and Research Foundation, Dr. Ifeanyi Sofor, said misinformation, insecurity, religious and cultural beliefs are some of the challenges limiting the country from meeting the vaccination target. Yes, and I believe so myself. There's a lot of religious limitation here.
You know, we actually have the vaccines for starters.
Yeah.
Because I remember
they are
looking for a
expired.
booster and not being able. So the expiration wasn't even a problem because they were pretty good. I mean, say whatever you will, right? Commend the structure that we have for the dissemination of vaccines. Actually, really, really good. So in terms of even the vaccines being destroyed when they got to their end of life, that was also done. The concern for me is, did we meet the target in the sense that, okay, vaccinate 200 million people, we put down 200 million vaccines, and then there's nobody to take them. So, yes,
Exactly.
we had a COVID problem here in that a lot of people didn't believe there was COVID. And to be fair, from a masses point of view, COVID kind of came and went. Like, God doesn't give you more than you can handle, and God knew we were not ready.
Thank you.
So it passed us over like the Passover. Thank you, Lord.
Hallelujah.
So it's not, did we have the vaccines to say, yes, we had enough to vaccinate to meet the target?
Nope.
And we didn't. I don't
Never.
believe that we
Not
did.
at any point.
So I don't think that even if you did, if you had the vaccines and then you said, oh, we destroyed 200 million vaccines because we didn't, but I don't think we had that.
Yeah, so it's not about us not wanting to take it.
Yeah,
that
it
it's
wasn't
not
available.
Yeah, she didn't want
Let's
to take
move.
it.
I'm anti-vax, by the way. But it's
Okay. Oh.
How do
All
you
right,
know
so my story, I picked this story for two reasons. One, first of all, the Nigerian media can be so badly behaved in their headlines.
Tell me about it.
So it says, dun dun dun, Buhari signs deal to allow UK offload hardened foreign criminals in Nigeria. It says, our new landmark agreement with Nigeria will increase the deportation of dangerous foreign criminals to make our streets and country safer. That comment was made by, I think her name is what, Priti Patel? The Home Secretary, yes, that's it, Priti Patel. So they signed this memorandum of understanding. And what it says basically is that if you serve a jail term in the UK and you're a foreign national, you can be deported. There's about, according to the story, it says that official estimates place the number of foreign criminals in UK prisons at 9,815. That's a huge pressure on
Our prisons that we
on
just
the
talked about which
system, right? And then, so they've actually sent the first batch home on Thursday. We had 13 Nigerians and I believe 8 Ghanaians. So same plane came to Nigeria, dropped off them, and then went and dropped off the others. Now, this is not a new arrangement. The US has been deporting, I mean, countries, I think it was back in 2016, Germany said they were going to be deporting refugees that commit crimes back to, so if they can't deport you to your home country because they don't know your home country is ravaged by war, they'll deport you to the first country where you entered the EU from. So this is not a new process. And to be fair, if you enter another man's country, don't take your anyhowness there. If you commit a crime, you left Nigeria to go to greener pastures for opportunity.
You get there, you're face to face with opportunities.
With all the opportunities, you still chose crime. Then you deserve to end up back in Nigeria. So
I agree.
This
The
story
problem,
for me,
no, they did not end them back in Nigeria because we don't have prisons.
don't want
already
them.
talk
no,
about-
so
Thank you.
Our prisons are congested.
They serve their time,
Yeah.
right?
So they're coming-
So they're bringing them back home. It's so in the UK, the only thing that wasn't clear for me, because I think in the UK regulations it says that you are exempt from deportation in the case where you've been, a criminal and served time, if you're a citizen of the Commonwealth. And I think it gives a date. So I think because we've all passed the date, so I think it was a date in 1973 where you then become exempt. Because Nigeria, we're a Commonwealth country, so technically you can't. But if you do the crime, if you suffered to get there and you did not look for work and you deserve to come back to Nigeria.
Okay.
So it's
On
not a
that
new
note,
thing.
let me take my story because it was quite troubling when I saw this. Kaduna community pays bandits 400 million to stop attack. So according to the village chief, or call him the community leader of Birnin-Gwari Emirate Council, his name is Alhaji Zubaru Abdul Rahuf, has said that they paid about 400 million to bandits just to allow them go into their farmland. So what they do is they pay in trenches. They pay when they're about to go farm, like to plant. Then when it's time for harvest again, they pay. So in that community in Gwari alone, they pay between 300 to 400 million. In another community called Rangdegi district, they paid about 200 million. So he was saying that he was saying that these are the three stages of paying and that these taxes that the bandits collect for them. So season, mid-season, and harvest season, right? So when I saw this story, I found it quite troubling because, I mean, you keep on talking about bandits and the war against bandits, and somebody would send me a message and says, oh, we're winning what war? Now, first of all, how about we start to follow the money? We've said this thing several times. Let's follow the money to find these people, because 400 million Uti, is it possible for you to carry 400 million again now in cash?
But I asked you guys the other time and you said, it's possible. And now you're throwing my question back at me.
No, I'm asking because it doesn't make any sense.
It doesn't make sense. That's my point. So
we are saying that we're operating a cashless society. So how are you able to get, so even if you're going to go and withdraw 400 million from the bank, shouldn't a blank flag it and probably put the guys to monitor you? There should be a system. Like, it should be really easy to do these things. Because now for them to pay bandits pre-season and mid-season, harvest season, so they split it in seasons, because now the states are becoming economically weak because they can't even go to their farmlands. And somebody's telling me somebody's collecting 400 million and yet we cannot find these people. That's really sad.
To say that we can't find them is something else. I think the question is,
are we willing to find them?
Are we even looking for them? That's sad. The thing.
All right, let's discuss business. Stay with us. We'll be right back.